Okay, so welcome everybody. Thank you so much for joining us today for this webinar that's very much focused on the COVID vaccine and how our populations can access it. We understand that you as our nonprofit community, our nonprofit professionals, have the best access to a lot of our most vulnerable and hidden populations in our community. And as such, we wanted to be able to provide you all with the information so that you feel armed with the information and potential questions you may face as you work with a lot of the populations that really we really want to see get vaccinated, so we can start returning to some level of normalcy within our world and ensure everybody's health is being protected. So we thank you for being on today's call with us. I'm going to do some quick introductions. First, today's moderator is Allison Hess. She is the Vice President of Health Innovations for Geisinger. She has been part of the Geisinger family for 14 years and is responsible for the oversight and implementation of health and wellness programs for Geisinger patients and their insured members, employees, and community members. She started a career in community health, education, and corporate wellness, and has continued to expand to include innovative community-based population health initiatives driven by data analysis and clinical outcome measurements. She has earned a Bachelor of Science degree in health education and her MBA from Bloomsburg University, recipient of several awards focused in various areas of health, including health equity, worksite wellness, and supply chain. She's also been recognized nationally for her work with the Fresh Food Pharmacy Program. She has 20 years of experience in the health and wellness field, and her most recent work involves community-based strategies impacting food insecurity and other social determinants of health. During the COVID-19 pandemic, she has helped lead Geisinger's community vaccine program. So Allison, thank you so much. We're so thrilled to have you with us today.
Thank you.
Also with us today is Dr. Allison Brezzinski. She's a board certified and fellowship trained specialist in infectious diseases. Her clinical interests include general aspects of infectious diseases, and her research interests include patient safety and quality of inpatient care. Dr. Brodginski attended the Lake Erie College of Osteopathic Medicine, where she received her medical degree and completed her residency at Weill, am I pronouncing that correctly?
Weill
Cornell, New York Downtown Hospital. She completed her fellowship at Mount Sinai Medical Center and is certified by the American Board of Internal Medicine. Dr. Brodzinski currently serves as the Director of Infectious Diseases for Geisinger's Northeast Region, Associate Chief Medical Officer for Geisinger Wyoming Valley Medical Center, and Director of Public Health Preparedness for the Geisinger System. She's been an integral part of Geisinger's leadership team throughout the COVID-19 pandemic, and her work is in building the quality program at Geisinger Wyoming Valley recently culminated in the hospital's CMS 5-star status. So thank you so much for being with us today, Doctor.
Great to be here.
We also have with us Tom DePietro, who is the owner of DePietro's Pharmacy in Dunmore. After attending Dunmore High School, Tom has earned his Doctor of Pharmacy degree at Temple University School of Pharmacy. Following graduation, he founded his pharmacy on the principles he learned from his parents' example, the attentive personalized service that's essential to customer wellness. Tom's approach applies not only to his customers, but to his community as well. He's dedicated to giving back to the community, which who have chosen DePietro as a preferred pharmacy. Volunteering and giving back is his way of saying thank you for the opportunity. So Tom, thank you so much for being with us today.
Thank you.
And finally with us today, last but certainly not least, is Joseph Hollander. Joe Hollander serves as the Chief Executive Officer of Scranton Primary Healthcare Center, which is our region's federal qualified healthcare center located in Scranton. The center opened its doors back in 1978 when the founders were looking for medical attention for the poor people within their community. Their efforts have resulted in over 216 million patient visits to the center since they opened. Joe is a graduate of New York University with a business management degree. And prior to joining the Scranton Primary Healthcare Center about 7.5 years ago, Joe spent 13 years of his career in the clothing manufacturing world. So Joe, thank you so much for being here, and we appreciate the expertise you can also bring to this discussion.
Thank you for the opportunity to join.
Thanks. And with that, Allison, I'm going to turn it over to you to begin today's discussion.
Thanks, Maggie, and thanks to the folks on the call as well for tuning in today, and hopefully we can provide you with some additional information and certainly welcome any questions as well. I'm going to start off with the first question for Dr. Brodginski, just to get her insight as to why it's important for the public to get vaccinated.
That's a great question. You know, we now have several COVID vaccines that have been developed and are being distributed to the public. And I think it's important for all of us to really understand the benefits of these safe and effective vaccines. And I want to start with the key point that these benefits far outweigh any mild or temporary consequences that someone may have to deal with when they're getting a COVID vaccine. First and foremost, you know, the virus SARS-CoV-2 that causes COVID-19, it's not benign. Unfortunately, I have firsthand seen many of the severe consequences that this virus can cause to individuals, the severe disease, the critical care stays and death. The possibility of serious complications for anyone that gets the virus, along with the idea that, there's a public health consequence. We're continuing with this pandemic. When we have a vaccine, here in our toolbox, there are two major reasons that I really want everyone to kind of sit there and think about, that personal effect of, we don't want you to get sick. This is a serious virus. And we all want to get through this together. And again, that's how we do that with this last tool that we have, which is getting this vaccine. Another good point is we now realize once we're vaccinated, we can start doing more. So the CDC has recently come out and said, look, if you're fully vaccinated, you are in a kind of safer range than perhaps an individual who has not received their vaccine or is still not in that fully vaccination range, whether they've only had one dose, for example. So we're now realizing that, we are a little bit unique in our protection against this virus. We could visit another household, unmasked. We can start going outside unmasked. So really thinking through the benefits, again, our own protective benefits, as well as the larger public benefits of all of us coming together. And I think, the last stop is, again, the idea that what do we all want? One common goal? We just all want to get past this. We really do. And we know it's going to take every tool that we have available to do this. And this vaccine is that last piece. So I think there are important reasons for all of us to understand.
Great, thank you. Yeah, I agree as well. Joe, I'll head to you next. What is important to consider when making a vaccine appointment? What do people need to be thinking about?
Well, at the present time, I think we can all state that vaccine appointments are fairly readily available. So I think they should pick a time and place that's convenient for them. They need to allocate roughly 30 minutes of their time for the vaccine appointment, roughly 5 to 10 minutes to complete the paperwork, another 5 minutes for the actual vaccination, and then they need to be observed for a minimum of 15 minutes to make sure there are no adverse reactions. They should make sure that the day of their appointment, they're not running a temperature, not feeling sick. They should be roughly 14 days out if they tested positive for COVID in the past. And probably more important than anything at this point is if they have a scheduled appointment and they can't make it or they change their mind, they really need to notify the people that they made the appointment with that they need to cancel. It's not just a courtesy. We're setting aside vaccine doses. Once we open a vial of vaccine, we have a minimum amount of time that it has to be used in. And it's no longer easy, and I'm sure Allison and Tom will attest, the end of the day is a real challenge now to try to find people if there are leftover doses. So just in an effort to help us all not waste any, just be courteous enough to notify people that they can't make their appointment.
Yeah, that's a great point, Joe. And we have seen that at our clinics as well. You know, when those no-show rates creep up, it does have an impact because of those logistics that you mentioned. I think the other important thing as well, now that we're vaccinating 12 and older, if you're scheduling an appointment, make sure you're scheduling it for the person who's getting vaccinated. And if that person happens to be under 18, if you're getting vaccinated, Geisinger, we do require a legal guardian or parent to be present for that as well. So when you're kind of planning schedules and planning that event, we just need to make sure that we have a legal guardian or parent in attendance.
Allison, if I can add just one last thing, and again, it's very in the forefront of our mind as a federally qualified health center, but it's important for people to know that they do not need insurance. There is no cost to be vaccinated, and that they should just feel free to come, and they will be vaccinated, and they need to be vaccinated.
Great point, Joe. Thank you for adding that. Tom, are people's preferences for a certain type of vaccine legitimate? Is vaccine preference affecting the rates for what you're seeing? Are you getting a lot of requests for that? Can you give us some insight there?
Yeah, so I think it's a great question, and I think it's one that initially appears to be an illegitimate concern. But what we're realizing, you know, as vaccination becomes more available, I often appreciate and respect anyone's concern. So if someone has a concern or a preference for a particular vaccine, maybe a couple months ago we were quick to dismiss that concern, but I think now we're at the point where any opportunity to start a conversation about getting vaccinated, so whether it's someone asking for a particular vaccine, I think it's a prime time to start the conversation as to why they have a concern about what vaccine they want. Oftentimes what I'm seeing is a person's interested in getting vaccine A because they heard their neighbor got sick from vaccine B, but their friend got vaccine A and they were fine. So I appreciate and respect anyone's concern about what vaccine they want. And I think it's a good conversation starter to explain to people how vaccines work, how everyone could react differently from a particular vaccine, explain the differences of the mRNA vaccines and the vector vaccines, and then really have a deep discussion with the patient on what their concerns are, if they want to be vaccinated, and why they want a particular vaccine. So I would just say at first, I think maybe providers viewed that as a illegitimate concern. But at this point, I think any concern is legitimate as we continue to fight trying to get people vaccinated. And I would also add to the second part of your question, I think a barrier to getting vaccinated was people had a desire for the Johnson & Johnson vaccine before it was released to the public. And then obviously the pause of the Johnson & Johnson vaccine was viewed as alarming to the consumers, which we would expect that to view. We would expect them to view that as alarming. But really, I tell my customers, look, you should be reassured that the government and the agencies paused the vaccine just out of, you know, very precautious safety measures. So my biggest takeaway as a healthcare provider at this point is being focused on the conversation. So I think just to summarize my answer, any concern or conversation is a legitimate concern from a consumer standpoint.
That's a great response. Thank you. And I think too, if people are interested in knowing what vaccine is available, that information is on the PADOH website. So they can go and see kind of where vaccines are located and the distribution for those. But I think you make a great point. It really comes down to having that conversation with that patient and understanding maybe what their potential concerns are and working through that with them. It's a great response. So I'll pose this out to the entire group. You know, in vulnerable populations, have you found difficulty in getting the second doses to those individuals? So for Pfizer, Moderna, are you seeing maybe people not coming back for those second doses? What are your thoughts there?
Well, I guess I'll start off. This is a population that we serve on a regular basis. This is based on what our mission is. And we have not experienced any problems in having people come back for second doses. We have been shipped Johnson & Johnson vaccine by the Pennsylvania Department of Health for the homeless population and the shelters. But when we've gone there, we've had people who have requested not to receive the Johnson & Johnson, again, for the reasons expressed earlier, and we've given them the Moderna vaccine. But we really have had very few people not come back for a second dose.
That's great to hear. Tom, how about you?
Yeah, so I think, our pharmacy was successful in deploying the vaccine in the community. So we were able to go to senior high rises, and we went to some low income community housing projects. So I think that removed the barrier of transportation. We have had great success, as Joe has had, with second doses showing up. I think what I would encourage people to do is really share multiple forms of communication with their provider. So we may get a bad phone number, but then we could have an email address, or we might get a bad cell phone number, but we have their emergency contact and we can contact the emergency contact. This is in the event they don't show up or forget their appointment. I think our county is extremely lucky to have Colts bus transporting people free for vaccine appointments, which I think has helped us really, get around the barriers of transportation, because we have had people call us and say we can't make it. So then, our staff has reached out to Colts and arranged that transportation to happen. We had quickly adapted the phone scheduling. So I think that overcame a lot of people who maybe wanted to reschedule their second dose appointment, but couldn't navigate an online system. So our staff was really flexible in adapting and doing it over the phone. Really, I think that the easier we make it for patients, and the more we talk to them about the importance of second doses, we really see that success rate of the second doses stay high. And I think luckily we have seen that as a trend in our county.
Yeah, that's really good to hear. I think we're actually seeing a little bit of a different lens. We are seeing some decrease in our second dose appointments, people keeping their appointments, but I think it stems back to Joe's earlier comment. They're sometimes getting it somewhere else because now there's just so much opportunity. I think if we all rewinded 3 months from now and people were literally driving 6 hours to get a vaccine, we're kind of in a different place. And so, depending on availability or people may end up getting that second dose somewhere else. So we do something similar where we call to check in. If it's just a matter of them forgetting or needing to reschedule, many of them will go ahead and follow through with that. But we have seen a little bit more of an uptake in those not getting those second doses, but I do think it's for that reason. And frankly, we think it's great wherever people get their second dose. It doesn't matter. And the state has actually, allowed us to be a lot more flexible with just doing second doses without a first dose, which has really helped with that. It just, again, I'll reiterate what Joe said. It really helps if you can just call and cancel any other appointments that you have, just to help the clinics who are providing the service with the logistics. So Allison, I'll go to you next. What do you think needs to happen in order to effectively educate the public to increase the interest level for receiving the vaccine? What can we be doing?
I think exactly what we're doing here is so important. Doing these types of outreach to the community where we're really trying to have a true open around the table discussion. I think that these are very, very effective. And every forum that I'm on, and if this question gets asked, I tend to have the same response, which is let's just keep doing this. Let's just keep, making sure that the public knows we're here. We want to answer questions. We want to make sure that you're getting legitimate information. And I do caution everyone, please be careful. There's a lot of misinformation out there, and you have to be very cautious where you're seeking that information from. The CDC, the Pennsylvania Department of Health, Geisinger website, we continue to refresh our information regarding COVID vaccinations, and really everything around that topic. And as new information comes in, again, we update that. So just make sure you're going to reputable sources. Encourage your community to take part in these conversations. So, I appreciate all of you coming on. If there's, and there will be more of these, encourage your neighbors, friends, your church family, whoever it may be, your work family. Hey guys, there's a new, conversation coming up in our community. Would you like the link? Because again, I think just making sure that we're all on the same page, dispel those myths and make sure we get your questions answered is the best way to do it.
Yeah, I agree. Tom or Joe, anything to add to that?
Sure. I mean, I think we're going to get there. I think it's going to be slow and steady, and it's going to be one conversation at a time. I think it's normal for people to understand you should have questions about the vaccine, and you should want to speak to a healthcare provider or a public servant or a community leader that you know and trust. I think we need to get to the point where we stop telling people to demand them to just get vaccinated. And I think we need to tell them why they need to get vaccinated. So it's not so much get vaccinated and just get in line, but we need to tell them this is why you need to be vaccinated. And whenever I start a conversation with one of my patients, I tell them straight up, like, I'm not here to convince you to make the decision to get vaccinated. It's going to be my goal to give you the information that you need to make a decision that's best for you and your family. If after we talk and you make a decision not to get the vaccine, I will completely respect that. And I'm in no way trying to force you to get the vaccine. So I think it's going to be those conversations that push us to where we need to be. Early on, I think the get vaccinated message was acceptable. But I think at this point in time, we're talking to a different group of individuals that are a little bit hesitant and want more information, and they shouldn't feel that's a bad thing. We need to embrace the fact that they want more time with us, they want more education, and then they may have to ponder it a day or two, and they're not going to get vaccinated on the spot, and we have to be acceptable to that. So I think those conversations are going to get us to where we need to be, and we have to understand that it's not going to happen, and we can't set fictitious timelines of holidays because we're beyond that. We really need to get to herd immunity, but we can't use an artificial holiday as a deadline. And I think healthcare providers understand that these conversations are going to be there, and they're going to happen slowly but surely, and we're going to get to herd immunity.
Great. Joe, anything else to add?
Well, I would just add that I think Allison hit the nail on the head when she said the information that's available on the internet is not always a reliable source, and people need to be careful of who they're listening to and what they're reading and the sources of that information. And again, speak to a trusted healthcare provider, speak to a trusted pharmacist, and get accurate information, because there is way too much inaccurate information around, and people start to pass this information, and suddenly in their world it becomes a reality.
Yeah, no, I think that's right. And, again, seek out from that trusted healthcare provider, I think, is the resounding message here, and have those conversations. And I think, Tom, your point is really well taken, about how that messaging maybe needs to change, based on the population, the fact that many coming in may have some hesitancy. And so providers preparing to give that additional time and walk through those concerns, I think is really critical to the success. So those were really great points. You brought up about, kind of convincing people of the vaccine and of its benefits. Does anybody have any suggestions on how we lead with that message, or opportunities to continue to get that message out?
I would say, what I always try to do when I'm in a conversation with somebody is find a common ground. So I think, as a father, I know I have a daughter. I also have a mother and a mom. I have some aunts that are elderly. So I think in a conversation with a person, you could always find a common ground and uncover a reason that they should probably become vaccinated, and try to find that with the person. So try to find the reason that if they personally don't want the vaccine, who should they get vaccinated for? So I guess my advice would just be to find the common ground between you and your patient, and uncover that so you could talk about it, and kind of just explore the conversation a bit farther than it may go if you don't find that common ground.
Yeah, Tom, I think that's really, really great advice, and I think very true. Being an infectious diseases doc, the idea of vaccine hesitancy isn't necessarily a new topic in my world. I can tell you, in the past, whenever a new vaccine technology came out, HPV, for example, occasionally it was the annual influenza vaccine. I do encounter some of my patients who would just say, no, thank you. And I agree. I think it has to be obviously approached with respect, and understanding that if you have some information that can help them with their hesitancy, if there's a specific question that they don't understand, to try to broach those again in a respectful manner. COVID vaccine, I don't think was any different than any other novel vaccines that were introduced over the last several decades. There are misconceptions that come about. I think earlier on there was a misconception that this would get the mRNA technology would somehow integrate something within this vaccine into someone's DNA. So again, I think understanding what the misperception is in the public, and helping us walk through why scientifically that is not correct. The understanding that this does not get incorporated into anyone's DNA. This will not give you the virus. This will not give you the infection. It's been scientifically proven over again. This will not cause infertility. So again, I think understanding what the common misperceptions are, and then, like you said, Tom, taking the time and understanding it's typically fear that drives a lot of people's hesitancy. And as humans, we get that. We all understand that. But how can we help with the actual solid information to help maybe alleviate some of that fear and start that discussion?
I think I would just add that it's important to understand that this vaccine was not rushed to market. It came to market. I believe they eliminated or reduced a lot of the red tape and a lot of the bureaucracy, but it was thoroughly tested, properly tested, and is certainly safe for the public. It's been in use since basically the middle of December with very little adverse effects that have been reported, and it is certainly safe to receive, and it's important that as many people receive it as possible.
Yeah, you guys all laid out really great points and help, I think many maybe feel more comfortable, help dispel some of those myths that are out there. And I think that transparency is just really important. And I think hearing from medical professionals like you all, it really kind of helps get that messaging out. So the efforts today will hopefully additionally kind of help with that goal. So Dr. Brodzinski, this next one's for you. Do you see a particular challenge in getting young children vaccinated when they become eligible for the vaccine? And just what do parents need to know about vaccination safety in this age group? And I think they're talking about this much younger population that's maybe slated for the fall timeframe.
Yeah, I think the first part of that question is, they're just like there's hesitancy, perhaps even in the adult population, there likely is hesitancy in that younger population as there as well. And again, I think because it's novel, so looking at the designs of the study, looking at all of the information that we currently have in this adult population, The great news, again, is that this is still continuing to be a safe and effective vaccination. As we know, there was recently an EUA granted for that 12 to 15-year-old age group range last week. And just in last week, the United States has administered over 600,000 Pfizer vaccinations, again, proving to be there was no major safety issues, safe vaccination. So I think, once we see a time, basically, tincture of time, I think more and more individuals become comfortable with that. A lot of the scientific community is now telling us that it likely will be end of summer or early fall when the clinical trials will wrap up again, even for the younger age group. It's realistic to think that by the end of this year, our younger age groups can receive, the EUA for the vaccination. Again, we're further out of time with the adult population that we're now talking about a full FDA approval for this vaccination in the adult group. And there is no reason to believe that something different would occur in that younger population. I'm a realist. I'm also an optimist. But the great news is the longer we're out from some of the end of this phase 3 trial, obviously still following all the safety data, there's nothing but good news coming out of this. So, we'll obviously continue to keep everyone updated if anything new comes up. The FDA is continuing to rigorously follow all this information. I think we saw that with Johnson & Johnson. They just said, hey, let's pause, let's take a look at the information. So they're doing the right thing. They're not skipping any safety steps. And we can assure you that as soon as we find any, information, good, bad, or indifferent, we get it out to you guys.
Great, thank you. Just kind of as we're getting towards close here, just wanted to pose to Tom and Joe, to give their insight into what maybe some of the biggest challenges have been in getting vaccines out to the public, and what our current situation is with kind of the supply chain and current supply.
Well, I'll go first, since Tom is sitting back and waiting. Some of the early challenges certainly were the State Department of Health in terms of communicating to the providers and the people doing the vaccinations of changing phases so that we could prepare in advance. We basically found out when the public found out, and it made for some uncomfortable conversations at different times as the phases changed. There was some hiccups in the supply chain, some of it weather related, some of it caused by ineffective bookkeeping, for lack of a better word, in the vaccine community. But I think we're past all of that. There is plenty of vaccine available. The situation still remains, though, that we're all doing our best not to waste any vaccine at all, and that's why it's important to try to cancel appointments if you have them. We are accepting, and have been right along, accepting walk-in appointments, and will continue to do so. And we're vaccinating every day. We're not only vaccinating patients who have scheduled appointments, but patients who are coming in for primary care or other visits, dental visits, prenatal checks, things like that. We're encouraging them and their family members to get vaccinated at the same time.
Yeah, I would just add, I think we saw an initial wave of people who were confident in wanting to receive the vaccine. Obviously, the supply and demand dictated how quick that would happen. Unfortunately, in today's society, everyone expects that it's going to be tomorrow. And unfortunately, that wasn't possible with this because it's a new product. So luckily, we're beyond that phase. And now that we do have supply available, I think we're just onto a different patient population who is just seeking out more information. And sure, I would love to host a mass vaccination clinic and vaccinate the rest of our community, but we just have to understand that the people do not desire that at this point. So again, just slow conversations are going to move the needle, and we're going to have to accept that as a victory, even though that victory might not come as quick as we want it to. We will be successful in vaccinating our community.
Tom, was it an accident when you said we're going to move the needle?
It was. I can't take too much credit.
So
Well
one of the questions that I think came in from one of our listeners, and so I'd like to put this out to the group as well. They're asking, what are the facts about those who actually should not be vaccinated? Are there individuals who should not receive the vaccine, or especially those who may have reaction to other types of vaccines? So I'll put that out to the group that came from the listeners.
I'll defer to Allison.
Sure. So the good news is there's not a lot to this vaccine. It's pretty simple in terms of the ingredients. And we now know that there are very rare instances where we would recommend someone not receive their first dose of a COVID vaccine. And those are individuals who have a severe or immediate type reaction to something called polyethylene glycol or polysorbate. And again, these are just ingredients that are found within the vaccine, but they're very common ingredients that are found out in our environment. Very common, in household products, for example. So it would be extremely unusual, if not impossible, that someone wouldn't know that they have a very serious reaction to these types of substances. We thankfully at Geisinger have not had any issues. I can tell you that I've had some individuals that after their first dose said, look, I developed a rash and, I'm just not comfortable with getting a second dose. And we work on those as a case by case basis with these individuals to try to understand how to best, guide them on whether or not there's a risk or benefit of receiving that second dose. But again, extremely rare. We understand what are the risks of not getting vaccinated. And that's obviously being vulnerable to this virus and the potential severe consequences of this virus. We also understand historically that there are communicable diseases that a certain population is going to be vulnerable because they cannot receive a vaccine, or perhaps because their immune system, is not ramped up enough, in order to mount an immune response to a vaccine. And again, I look at it that's our job to protect our community. That's our job to make sure that, we're keeping a virus at bay, to protect those that are vulnerable, that can't receive, a vaccination or perhaps develop immunity to an infectious agent. But overall, the good news is extremely, extremely rare circumstances that we would recommend someone does not receive this vaccine. If you're concerned, if you have serious allergic reactions, not to animals or environmental allergies or medications, but again, specifically to polyethylene glycol or polysorbate, talk to your primary care physician. You're likely seeing an allergist. Speak with your allergist and immunologist, and your friendly local ID doc. We're always here to help you guys with those questions.
Great, thank you, Allison. So we'll just kind of finish up here with the last question that we have, and then just make sure we don't have any others from anyone who's listening. But I guess I'll just have each of you kind of close us out with, what do you most want individuals to know about COVID vaccine that maybe we haven't already covered, or just that you want to reemphasize that we've already covered? And Joe, we'll start with you, if that's okay.
Thank you, Allison, and thank you for taking the time today to moderate this, and thank you to the Scranton Area Foundation for presenting this. I think it's important for people to know we've been administering the vaccine since the 3rd week of December. We have not had a single patient contact us or return as a result of side effects from the vaccine. In addition, people need to remember that the vaccine is not fully effective until 14 days past the final dose. If it's a single dose vaccine, then it's 14 days after the first dose. In the case of Moderna and Pfizer, it's 14 days past their second vaccination. And just as a general rule, not knowing what's going to happen going forward, I think it's a good idea that they maintain their vaccine card that they receive in a safe place. Most people today have a smartphone. Probably not a bad idea to take a picture of the card so that you have a digital record just for future reference. And again, thank you for the time. And if anyone has any questions, if anyone has a desire to be vaccinated, Scranton Primary is here every day to assist them.
Great, thank you, Joe. And that's really a great point about, keeping record and keeping track of the vaccine, especially as there's so much opportunity, which we're incredibly grateful and thankful for, and making sure that people are keeping track of that. Excellent. Thank you so much for your time today. Tom, how about you?
I think when I have this conversation with the patient, I really see their eyes light up. So, most people perceive a vaccine to be a piece of the virus, whether it be a live piece of the virus or an inactive piece of the virus. So many people have that hesitancy because they perceive that the vaccine has a piece of the coronavirus in it. When I'm able to sit down with them and tell them, here's an example of a vaccine that is a live virus, meaning it has the active virus in it. Here's an example of a vaccine that has dead virus in it. And the coronavirus vaccine, the COVID vaccine, is neither of those two. But this is how it works. And when I give them the little explanation of how it works, and it's basically an instruction manual for your body to be able to fight off the virus, that's where really I see their shoulders drop down and their ears perk up and they listen. So I think the biggest thing I would deliver to a patient that is on the fence, if you could learn anything about the vaccine, is ask a healthcare provider, how does the vaccine work? And I think that is a great way to start a conversation for someone who is on the fence to get vaccinated.
Great feedback. Thank you so much for that. And thank you for your time as well today. Dr. Brodginski, any closing thoughts?
Yeah, thank you again, everyone, for joining. I think these conversations are fantastic. It's interesting that this pandemic, I feel, has certainly brought healthcare organizations, pharmacies, our local political leaders and the community all together. So I would say, let's keep doing this. I would encourage all of you to continue to reach out to your local healthcare organizations, whoever they may be. Reach out to your local community leaders, your families, your friends, and say, let's just keep talking. COVID is, it's going to be here with us for a while, but it doesn't look so scary now. And I think that that's a really important thing, that we keep talking about the really important tools that we now have in our pocket. We keep talking about concerns that we have about some of the vaccines. We keep talking about, what's expected. What are we thinking about 3 months down the road, 6 months down the road, a year down the road? Let's just keep these conversations up. And again, all of us are always here, to help in these conversations, answer these questions. And just all of you, please, continue to be safe and keep educating yourselves. Thanks so much.
Great. Well, thank you again to all the panelists. Thank you to everybody who listened today and posed questions. And at this point, Maggie, I believe I'll turn it back over to you.
Yeah,
Allison,
absolutely.
before you do that, I did see that there was one more question posted, and that was regarding a booster vaccine.
Yes.
And
Oh, okay.
I'm happy to defer to Doctor, but from the research that we've seen from the advice that I'm getting from my chief medical officer and others is, I don't think any one of us know the answer to the question whether there will be a booster dose necessary down the road. I think the best answer is to stay tuned, and we'll all find out somewhere in the future.
Yeah, Joe, thanks for seeing that last question pop up. You know, the current information that we have regarding the duration of immunogenicity, or how long does that immune response last after you're fully vaccinated from either the 2 doses of Moderna or Pfizer, or the 1 dose of Johnson & Johnson. You know, we definitely had a sense at that 6-month mark, we're still seeing really, really protective levels. So that's not to say at month 7, they're gone. It's just to say that so far the information we have at hand at 6 months looks really good. As we continue out, you know, further from that 6-month mark, we're getting and we're learning more information. And we'll obviously get that out to you. There's been some discussions. I think it's more of press release types of discussions, not hard data, that says we may need a booster vaccine and then possibly annual vaccinations. But to Joe's point, we don't know. What we do know is at that 6-month mark, we look really good. I remember answering this question, you know, back in like, you know, March, and saying, hey guys, at 3 months, we look good. You know, the data has come out from the trials. And now that we're further out, we have that 6-month information, and we'll wait to see what's going on with that 9-month information. And we'll get that out to you.
Great,
Excellent.
thanks, Allison.
Thank you. Well, first, thank you to all of you so much for your insight. This is this information is so valuable, and I'm thrilled that we have a recording of it that we will be able to share out with the rest of our nonprofit community, and to any participants on with us today. We will share that link out to you as well. So if you either want to go back to the information or say to your coworkers or friends or family, hey, I heard this great webinar, take a look. So we'll be sharing that information out. Joe, thanks for your eagle eye and spotting that last question. I was just about to hop in with it, and so I'm glad we got to answer that. Without any additional questions from our audience, we will wrap it up here. And just again, my eternal thanks to everyone who was able to join us. We really appreciate your information today. So I hope you all enjoy this beautiful warm weather that we get to enjoy.
Thank you.
Thank you for the opportunity to participate.
Thank you all.